12 cranial nerves assessment. So let's start with the cranial nerve 1. So 1 is olfactory nerve. So check the patency of the nostrils. So I will ask the client to close the mouth and occlude one nostrils with one finger, and ask him to breathe in and out through the open nares. So, sige. Close mo dyan, Misa. Sige, tungas ka. Sige, Misa. So, as a result, air moves freely as the client breathes through the nares. Next step, I will test each nostril separately. Have client identify a distinct odor. So, I will use this one. So, I will ask the client to close his eyes and then occlude the one nose. And then I will use this one and I'll let him smell it and occlude the other nose. And I'll let him smell it again. So as a result of that, the ability to correct this or distinguish the odor presented under the nostrils are he smells it correctly. Okay, so the next assessment is cranial nerve 2, which is the optic nerve. So this is a test visual activity. So allow client to wear distance glasses if he have, but since he doesn't have glasses, next step is position the client 20 feet from a Snellen's wall chart. So after positioning the client, have the client cover each eye in turn and read the chart. Then let's see the result.
E F P T O Z L P E D P E C F D E D F C Z F F E L O P Z D D E F P O T E C E F P T O Z L P E D P E C F D E D F C Z F F E L O P Z D D E F P O T E C.
So next assessment is the cranial nerve 3, cranial nerve 4, and cranial nerve 6. So that is the oculomotor, trochlear, and abducent nerves. So first step is observe for ptosis. So test the extraocular movements. I will stand in front of the patient and ask the patient to follow my finger movements, and I will check for the gaze in the 6 cardinal directions using a cross or H pattern. So I will pause during upward and lateral gaze to check for nystagmus. So okay. So as a result of that, eyes move smoothly and bilaterally in 6 cardinal fields of gaze. So the next step is check for the convergence by moving my finger toward the bridge of the nose of the patient. Okay, so as a result of that, both eyes converge on my finger as I move my finger at the same level and distance. So patient maintains gaze on my finger when it is held from the bridge of his nose, and when the patient eyes converge, both of his pupils constrict and remain constricted. Next cranial nerve assessment is the cranial nerve 5, which is the trigeminal nerve. The first test is to test the corneal reflex. So I will ask the client to look up and away. From the other side, touch the corneal light with a whip of a cotton and look for the normal blink reaction to the both eyes. And I will repeat it on the other eyes. Ano ka nga, kamay ko dito. Di lang matang. Tingnan to. Okay, so as a result of that, the patient blinks and his eyes tear when corneas touched. So the next assessment is cranial nerve 7. This is the facial nerve, which is the first one is to observe for any facial droop or asymmetry. So asymmetry, the patient's face is symmetrical facial contour, lines, sprinkles with a symmetrical facial movement. And the second test is raise the eyebrow, okay, and close both eyes resistance. Okay, so as a result of that, the patient resists efforts to open her eyes. So resist. Okay. So smile, frown, and then puff, show teeth, smile, puff out cheeks. Okay, so as a result of that, patient retains puff cheeks despite the efforts to collapse them. The next assessment is the cranial nerve 8, which is the acoustic or the vestibulocochlear. So first is the screen hearing. So I will face the patient and hold out the arms with my finger near each ear. So I will rub my finger together on each side while moving the fingers noiselessly on the other side. So I will ask the client to tell me when and which side he hears the rub. So at the same time, I will increase the intensity as needed and note any asymmetry.
Right.
Okay. So as a result of that, the cranial nerve 8 are equally hearing in both ears. The next assessment, which is the cranial nerve 9 and 10, which is the glossopharyngeal and vagus nerves. So first test is to listen to the client's voice. Say hello.
Hello.
Okay, so the patient voice are clear. It is not from the nasal. And I'll ask the client to swallow. Okay. And ask the client to say ah. Ah.
Ah.
Okay. So when the patient speaks ah, his soft palate moves straight up. And the next is test for the gag reflex. So I will use the this one to test for the gag reflex. Ah. Okay, so patient gag reflex are intact. So the next cranial nerve assessment is cranial nerve 11, which is the accessory nerve. Okay, so the first test is from behind. Look, atrophy or asymmetry of the mastoid, of the trapezoid muscle, I mean. So ask the client to shrug shoulders. So it is against resistance. So patient left shoulders despite the downward pressure. And the next test is ask client to turn head against resistance. Okay, so firm jaw pressure against my hand resistance. So the last cranial nerve assessment is the cranial nerve 12, which is the hypoglossal nerve. So I will listen to the word of the client, say hello.
Hello.
Okay, so I will observe the tongue as it is in the mouth while he is speaking. So the tongue is motionless and centered on the mouth floor. So protrude the tongue. 3, 4. Okay, so protruding the tongue appears centered between the lips and the a slight tongue movement. So the last test is the move tongue from side to side. Okay, so as a result, patient exerts firm tongue pressure against my fingertips.